G'day, Stephen Playford is my name. I'm CEO of Australian Sheepskin Apparel located in Saskatoon, Saskatchewan, Canada. In this session we're going to be talking about healing animals with Australian Medical Sheepskin used as a dressing. We've done many cases over the years, and animals heal very well because they are very compliant and they will take what you give them as far as protein and their meds and such is concerned. And the product shows amazing abilities of healing the wounds. In this circumstance today we're going to show you two animals, one a dog and the other one a horse that was registered or meant to be registered as a cutting horse, and we show you the healing effects of Australian Medical Sheepskin used as a dressing. Bear in mind these wounds are quite graphic in nature, so viewer discretion is advised. Firstly, you can see here the paw of a dog, and this dog's name was Zach, and he had been hit by a car, and you can see the wound on the paw there that had been pre-existing for a period of around about a month and a half, and it was not getting any better. It was one of those types of wounds that he kept tearing any dressings that we had on there off, and he kept licking the wound and kept on making it worse. So from day one, when we started with the Australian Medical Sheepskin, you can see that the dressing or the bandage that was put on the end of the paw. Now this leg was paralysed. He severed the brachial nerve in a motor vehicle accident, and the leg was not in use. So the paw was folded up and that bandage was placed on over the wound. We didn't know at the time whether he was going to keep that sheepskin dressing in place or not, but it had absolutely no problem with it whatsoever. It didn't interfere with him. He did not even try once to remove the dressing and was compliant with it right the way through. You can see here a little closer, it was just like a little bullet that his foot slid into, which was velcroed around the back of the leg, and it stayed in place perfectly. You can see here from day 1 to 18 days, you can already see that there is hair starting to regenerate around this area, and the wound is opened up to a very clear, clean wound with zero infection involved whatsoever. At 22 days you can see that we've got lots and lots of granulated tissue that has already started occurring around that wound, and again with more hair regeneration. At 28 days you can see it's just basically down to a little pinpoint, and at 33 days the wound is completely gone with full hair regeneration as well. The reason why these wounds heal so effectively, and in animals with the hair coming back, is that the product brings blood flow to the outer layers of tissue. In that blood flow is what the animal requires to heal within the wound. These next series of photographs that we're going to show you are of a colt that was born to be a registered cutting horse, and it was kicked and bitten by a gelding from the day that it was born. We have also dealt with horses that run into barbed wire fences, with cows. We've dealt with cats that have had mishaps with dogs and such and been very severely injured, but completely healed with Australian Medical Sheepskin. As I said, these next photographs are quite graphic in nature. This is the front left quarter of a colt, as we said, born to be a registered cutting horse. But these wounds on the front left shoulder, once healed, would normally leave scarring and such, which would inhibit this colt from being registered as a cutting horse, as they can have no scarring on them. You can see the wound up the top there that basically is, you can fit your fist into that wound. The wound just down from that is tunneling towards that. Those two wounds would have become one big wound, and you can see the wound on the back of the elbow and the tendon. This was done in 2005, and I want you to look at the dates on this, which is quite dramatic. When we go 10 days later, pardon me, you can see here that the drains that were placed in these wounds by the vet in a bid to try and keep the moisture content out of the wound have now become too large for the wounds, as the wounds have already started to regress. You can see that top wound is rolling on the edges, and it's becoming a much shallower wound very quickly, and we've already got granulation occurring in that wound. The other two down the bottom, you can see that they are much smaller, and there is no tunnelling occurring in the wounds themselves now. At 14 days, this is how they dressed the little guy, in half a pair of pyjama pants. And what they did for the dressing for this guy was they took a large bed pad and they cut it into 3 pieces and put that on the shoulder and held it in place with the half a pair of pyjama pants on the body. Very effective, and it kept it in place at all times. And the little guy didn't mind with the sheepskin. There is something about the sheepskin and the animals having an affinity with it that they don't try to tear it off or get rid of it. They seem to continually leave it in place. It's as though they know that it's doing them good. You can see here at 14 days, look at the wounds, look at the granulation that's already occurred there. In the elbow at the back, we already have full granulated tissue over the elbow and the tendon, and you can see that the other two wounds are virtually a memory. They're just completely pulling right up. But again, look at the hair regeneration that's occurring. That is because we've got blood flow coming to the outer layers of skin tissue. That's bringing with it the antibiotic, it's bringing the granulated tissue through protein. It's bringing with it the white blood cells, the oxygen cells, everything that we need to help fight bacteria and keep the tissue itself alive. As we progress through to 19 days, you can see how much rolling is occurring on the back of the elbow. And this is what we wanted to try and capture there, to show the granulation occurring in that part. You can see here at 21 days there's been no mechanical debriding of these wounds whatsoever. And the vet did actually come out this particular day and said, while we're here, why don't I debride that piece of necrotic tissue that you can see on top? That's the wound that you could fit your fist into. There was no need for mechanical debriding. As at 35 days, you can see that these other two wounds down the midsection are completely gone. The wound up top is almost a memory, and so is the one on the back of the elbow and the tendon. Again, look at the hair regeneration. This is quite astonishing. We see this every single time the product is utilised. And this is a wow, look at me now. This was, all wounds were completely healed on this little fellow at 6 weeks. And at 3 months, this is him as a registered cutting horse. So not only did he not die or was put down by the vet because the wound's getting too bad, or just healed to a point where he was able to just run the kids around on the farm, they were actually able to register this guy as a cutting horse. The reason being for that is that there was no scarring whatsoever because there was no mechanical debriding. One thing to think of, this was all done in the most highly infectious environment that you can have. This was done in a barnyard. With those kind of results in Australian Medical Sheepskin being utilised, it creates results that in many circumstances no one would ever realise being a reality to heal the wounds. I hope you've gained something out of this session. If you have any further questions, please don't hesitate to get a hold of us on Australian Sheepskin Apparel at shorebiz.ca. AustralianMedicalSheepskins.com is our website, and thank you so much for your time.